Hello, everybody. Thank you so much for joining us. A very warm welcome to all of you. Good morning, good afternoon, and good evening or night, wherever you are. Thank you for joining us in this C20 Summit event amidst COVID-19, putting the last mile first, co-convened by Fundación Huésped, Global Health Italian Network, Global Fund Advocates Network Asia Pacific, and Italian Association for Women in Development, and co-organized with the Africa-Japan Forum, Global TB Caucus, Impact Santé Afrique, and WACI Health. My name is Rachel Ong, the Regional Coordinator for GFAN Asia Pacific and one of the co-facilitators of the C20 Global Health Working Group, and I am based in Singapore. Today, we bring together an exciting panel of speakers from both communities and civil society, as well as global health institutions. So this is happening 9 years before we meet another deadline. The deadline for attaining the 2030 Sustainable Development Goals, for a discussion on what is necessary for achieving SDG 3, ensure healthy lives and promote well-being for all at all ages, and SDG 5, achieve gender equality and empower all women. And more importantly, this discussion will bring to you messages about how do we do this sustainably and by putting the last mile first. We have a lot of important messages to share with you today. So before I go to our very first speaker, we just wanted to share with you to please stay on after the session for the final session of the C20 Summit, where we will be presenting our final communique. So without further ado, I'm going to present to you Stefania Burbo. She's the chair of the C20 and one of the co-facilitators of the Global Health Working Group of the C20. Stefania.
Thank you, Rachel. And thanks to all the welcome speakers and participants for joining this plenary side event of the C20 Summit. I would like to take the opportunity of this event focused on human rights, equality, and gender transformative approaches to highlight that the guiding principle of the C20 are leaving no one behind, a gender transformative lens, a real sustainability and policy coherence to link together the future of the planet and of the people. Regarding global health, the C20 has the overarching goal of achieving universal health coverage, and we advocate for health as a global public good and a human right, which is critical in achieving the SDGs. We are firmly committed to ensuring women and girls in all their diversity, vulnerable groups, marginalized communities, and key populations are at the center of global health strategies and responses. Unfortunately, while the world continues to race against the spread of COVID and its variants, we continue to see the disparities in COVID vaccines and tools access. Their distribution is so unequal in the world, maintaining the poorest areas in more vulnerable conditions, and on the other hand, keeping the world exposed to new strands of the virus. We call for more coordinated and financed collective actions to halt and reverse not only the impact from COVID, but also to address the other health crises. Despite long-standing global commitments, the world has yet to end HIV, AIDS, TB, and malaria as epidemics, eradicate neglected tropical diseases, manage non-communicable diseases, and address mental health effectively, provide quality services for nutrition, water, sanitation, and hygiene, and sexual and reproductive health and rights. Clear lessons from these experiences have taught us the paramount importance that people's lives must come before profit. As a C20, we will continue to work for the recognition of human rights and against inequalities in COVID vaccines and tools access under the guide of our Indonesian colleagues who will have the C20 presidency starting from December. Thank you very much for your attention. Rachel, over to you.
Thanks so much, Stefania, for those very brilliant and strong messages about the changes we want to see for people's lives, for equitable healthcare, placing people in the center of responses, and that importantly, lives have to come before profit. So I do have a very exciting panel of speakers. We have Dr. Ren Minghui, or Minghui Ren as the last name, the Assistant Director General for UHC, Communicable and Non-Communicable Diseases from the World Health Organization. We have Dr. Zolelwa Sifumba, medical doctor and clinical research fellow at the African Health Research Institute based in South Africa, a very young and passionate speaker. We have Dr. Luchika Ditu, executive director of Stop TB Partnership, based in Switzerland, but she's actually now currently on the road in Romania. We have Lucas Nunes, a designer of the Regional Youth Network of Youth Living with HIV, Latin America and the Caribbean, J+LEC, from Chile. We have Dr. Julita Onabanjo, Director of the Technical Division, UNFPA in the United States. Daniel Marguari, Executive Director of Spiritia Foundation in Indonesia. And we have Peter Sands, who is the Executive Director of the Global Fund in Switzerland. We have to apologize that Peter will be only joining us 20 minutes before we end, as he is now caught up in some committee meetings at the moment of the Global Fund. And we will then end off with closing remarks that we made by Kurt Frieder from Foundation Huésped, Argentina. So on to the very exciting news that we have this morning when I switched on the TV. Congratulations to all our colleagues, and especially for our colleagues in the malaria movement and WHO for the announcement of the new for the new malaria vaccine. I will not try to pronounce it. I will probably get it wrong, but it is actually so exciting. So Dr. Ren, the first question is for you. Universal health coverage commitments in achieving SDG 3 have been severely impacted by COVID-19. This has impacted economies and health systems globally. How can we ensure that more than ever we have to put the last mile first and not to leave anyone behind? What do you think WHO's role is in this? And how can we achieve this collectively and hold countries accountable?
Okay, thank you, Rachel, for this very important questions. Also, I join your congratulations. It's absolutely fantastic news, as I said, for malaria, and also probably not only for malaria, for all the communicable diseases, because we see the new hope of lines. Maybe the other vaccine can be developed for other communicable diseases in the future with the support of scientists. Let me start by saying that, in my view, maybe it's too early to talk about the last mile with respect to COVID-19. To me, talking about the last mile means talking about the eradication or elimination of disease. That is, if ever possible, still some way of COVID-19. But we can do a lot of things together now. First of all, I think we believed we have an opportunity now, and what is more, moral imperative to learn from the past and current pandemics and to build back better, and to do so in a way that lessens and in a way that leaves no one behind. One important and strong lesson from COVID-19 pandemic is that we need to build strong and resilient health systems. Without the capacity of the health actors, institutions, and populations to prepare for an effective response to the crisis and to maintain a core function during a crisis and to reach the population through the integrated people-centered primary healthcare services, countries cannot succeed in tackling pandemic or eradicating or elimination disease, including HIV, TB, and malaria. Secondly, we can't allow ourselves to be complacent with respect to our commitments towards SDG target for ending HIV, tuberculosis, and malaria, non-communicable diseases, and neglect tropical disease, and the mental health condition, and many of which I'm thinking in particular about NCD and mental health deserve to be called silent pandemics, and like COVID-19, far away from the last mile. Given this context, WHO will continue to support country to progress towards universal health coverage and primary health care as a foundation of universal health care and robust resilience health systems, making sure that the universal care and primary health care workers for all people And the community requires everyone, WHO, civil societies, partners, to use their comparative advantage in supporting the countries and their full and long-term commitment to this end. Countries in the end will have to take the balanced approach, focusing equally on the health system strengthening and disease-specific intervention and services. So with that, I think we can absolutely reach our target and for our commitment. And also, as we emerge from the pandemic, we all have to hold each other accountable to ensure that we give the countries that support they absolutely need, and that we put the most vulnerable population first. This is absolutely our target and the goals in common. Thank you, Rachel.
Thank you, Dr. Ren. That is actually really important messages. And I think that primary healthcare is something that's really undervalued in many places. And we've seen how important it is during COVID-19. So I moved to Dr. Zolelwa Sifumba. Zolelwa is actually is in the healthcare sector. Dr. Zolelwa is actually in Africa. So the question to Dr. Zolelwa, the African region has seen the highest investments overall in mobilizing resources for health internationally. Yet we continue to see disparities between investments and results. So as a TB advocate, an MDR TB survivor, as well as a medical practitioner, please share with us your priorities and recommendations in sustainably improving responses in the African region for better and more resilient health systems. Dr. Zolelwa, I think there's something wrong with the audio. We can't hear you. No, I still can't hear you. So maybe I'll come back to you in a bit while you sort this out. Yeah, because I still can't hear you. I'm really sorry, audience. So maybe let's move to Dr. Lucica. Lucica, thank you for joining us on the road in Romania, in your hometown. I think it's really important to emphasize that while we have found, or while the vaccine has been shared in the world for malaria, we're still waiting with bated breath, and no pun intended, for something for TB. I mean, one of the oldest diseases in the world as well. So the Deadly Divide report by the Stop TB Partnership has highlighted significant impacts on COVID-19 on TB, as well as other diseases and comorbidities. So what are the key recommendations necessary to immediately shift gears in G20 countries, where some of them actually have the highest TB burdens, both in TB and MDR TB, which is so expensive, to be able to close the divide and ensure a sustainable recovery?
So thank you so much, Rachel, and I hope you can hear me. First of all, thank you guys for doing this. This is absolutely perfect. Thank you for the conversation. I'm honored to be here with you, and I'll just go to the points, not to waste the time. First, G20 countries are having 50% of the TB burden. So if G20 countries will take care of their own burden, we will remain with 50 to take care ourselves. So G20 needs to start moving themselves. And what is needed to move, there are three ingredients needed. One is the political commitment. We saw with the COVID that it's possible. If there is a will, there is a way to do. There is a way to develop diagnostics. There is a will to collaborate. There is a will to share. Of course, we need to address some things. Not everything was perfect, but in terms of speed of bringing tools, political will bring it out there. The second ingredient are money. TB is severely underfunded for a long time. There is a responsibility of G20 to step up their engagement and the funding in TB. But the third, and it's not the third left because it's the least important, it's actually the most important, are the people. Civil society and communities. Deadly Divide should be at the center of the entire response. Deadly Divide highlighted this. You see, if we want to really address not just TB, but any future pandemic, we really need to construct from the communities and civil society upwards. We need to construct around human rights and gender. And we know how to do this We are looking forward to push the agenda as it continues. But if we are not able to empower and to really and genuinely put the people that are in the communities, the affected people and civil society as providers, as supporters of the delivery. You spoke about primary healthcare. Indeed, in some places can be through primary healthcare, but in other places, the community health workers, the volunteers and the networks available can intervene and can be amazing, not just in advocacy and communication, but in delivering services and being at the core of intervention. You have these three things, you are able to address and end TB and end COVID and end everything. Thank you very much.
Thanks so much, Luchika. I'm going to come back to Zolelwa again. And Zolelwa, is your audio now working? I'm sorry, Zolelwa, we still can't hear you. I'm going to suggest maybe you might want to log out and log in again, and then we'll come back to you in a bit. I'm really sorry for the technical difficulty. Everything was working just now when we had a test. I'm going to then move to Lucas Nunes. Lucas is actually a non-binary or neutral pronouns, visual artist and independent researcher, as I mentioned, that is based in Chile. So coming from a key population, what do you see of COVID-19, which has disproportionately affected the elderly and increasingly the young people and children with the Delta variant? How has it impacted the lives and livelihoods of young people, especially young people living with HIV?
Okay, first, I would like to thank you for letting me contribute from the perspective of young people living with HIV. Now, regarding the question, before the appearance of the Delta variant, it is important to consider the context of some countries of Latin America and the Caribbean during the past year. On August 2020, our network published the results of a survey that showed how 787 young people and adolescents living with HIV between 15 and 29 years old dealt with the COVID pandemic. Many of them have not sufficient personal and domestic protective equipment and experienced delays in the provision of emergency health services. The majority were concerned about their mental health and emotional health and considered that they needed psychological support to address anxiety in the context of the COVID-19 pandemic. Most of them felt that the confidentiality of their status could be affected, and some people even have refrained from using any service during the pandemic for fear of being discriminated for living with HIV. Finally, most of them felt that they could be suffer physical, psychological, or even verbal violence for living with HIV during the pandemic. So that was like really bad. Now, during the months of August and September of 2021, the team of key correspondents in charge of COVID and HIV circulated a regional survey in Spanish to be answered exclusively by people living with HIV in Latin America to assess the access to vaccines against COVID-19. I would like to highlight two things in particular. First, only 37 of the participants reported that the priority of their country has been given to the vaccination of people living with HIV, while 43 of the people surveyed indicated that in their countries, they have not been prioritized. From what is known so far, some countries explicitly included people with HIV in their vaccination plans as one of the priority groups, such as Mexico, Guatemala, Chile, Argentina, Peru, Ecuador, among others. But in some countries, however, the implementation of such prioritization did not occur at the national level because 30% of the vaccines that were offered to people living with HIV were administered just in capital cities and in large metropolises, while this percentage falls to less than 10% in other cities and regions of the countries. The findings of the survey were consistent with similar studies carried out in those countries. Some significant gaps remain about access in terms of times and form related to vaccines for people living with HIV, both in their communities and health systems and their services. We could infer that in many cases, there is a greater community knowledge about vaccination and HIV than in the national programs and in the health professional sector.
Okay, thank you so much, Lucas. So let me come back again to Zolelwa. I hope the audio is now working. Let's give it a try.
I hope so too. Can you hear me now? Yay! Oh my gosh, I'm so happy. Hello, everybody. Hi. I'm so excited to finally be on. So, hello, everybody. Thank you for having me. My name is Dr. Zolelwa Sifumba. I am really happy to be here because being voiceless has been my biggest pain. And I say this as a health worker and as a survivor of multi-drug resistant tuberculosis. And so I'm really excited to be speaking here today. And what I will say as a healthcare worker, and as a survivor of multi-drug resistant TB and COVID-19 that I contracted both on the front line, I think we need to stop expecting resilience from our health forces, and what we need to start doing is supporting them. We need to be listening to the voices of those affected, because those voices are not being heard, and those voices are asking for tangible support. Those voices are from frontline workers who have, even before the COVID-19 pandemic, we have been tired, we've been burnt out, we've been suffering from high levels of contracting infectious diseases and high levels of anxiety and depression and things like that. But we need to allow for these voices, these frontline health workers and the voices of those affected by infectious diseases and non-communicable diseases and all the other diseases. We need to allow for them to hold our leaders accountable. We aren't, as healthcare workers, we aren't heroes. We also need support. As humanity, I think it's our responsibility to look after our healers, and it's our responsibility to support them and provide the infrastructural improvements that actually have existed for years, but COVID has actually come to unmask. So again, I say I'm so excited to be here for health workers because I have been voiceless and a lot of us remain voiceless throughout the pandemic. But my challenge here today and my call to action is that our leaders start to listen to our health force and find where support is needed. Thank you.
Thank you so much for raising such an important point. The healthcare sector has been undervalued in this response tremendously. I mean, so many of our healthcare workers actually had passed away, unfortunately, because of inadequate commodities to protect their lives while they had tried to save others. So I think that the call is heard, and we need to make sure that action is taken to make sure that when we talk about
really not okay. It's not okay that so far into the pandemic we've not invested in our frontliners. So thank you. Yes.
Thank you so much. I will come back to you later with another question as well. And I'm going to move to Dr. Julita. So given that the new architecture of health is emerging, what do you think needs to be done to ensure that sexual reproductive health and rights are placed at the center of this new global health architecture amidst, COVID-19?
Thank you, Rachel, and allow me to really thank the co-conveners and co-organizers for inviting UNFPA, the UN Sexual and Reproductive Health Agency, to join this important conversation. And let me really appreciate the speakers before me, but especially to Dr. Zolelwa, for giving voice to those frontline healthcare workers. So really, thank you. And in a way, I want to pick up from that, in that, we do have an opportunity now as we think about building forward better post-COVID or with COVID. And the global health architecture moves us towards what is a more targeted and focused perspective on this notion of universal health coverage and primary health care, and really reigniting that. And so the first thing I think that needs to be done as it relates to specifically sexual and reproductive health is really a better global and local recognition and conviction to the commitment that you will not attain universal health coverage if you don't attain universal access to sexual and reproductive health in its entirety and for all, whether it's women, adolescents, youth, key populations, and vulnerable groups. And that actually guaranteeing sexual and reproductive health and rights not only has a high return on investment within the health sector and across health outcomes, but really a multiplying impact on the larger sustainable development agenda that we need to achieve. And I'll quickly illustrate that with some work from the Good Marker on adding it up that show that for every dollar spent on contraceptive services beyond the current level will reduce the cost of pregnancy-related newborn care by $3, a cost saving that can be reinvested in the healthcare system. And further, for every woman that can plan her pregnancy and make a fundamental choice about her body, she not only gains that autonomy and agency and voice, but also gains in advances in education, income, and broader developments for the family. And these add up with ripple benefits for us all. And let me present it another way, just because Lucas comes from Latin America. UNFPA did a study in 6 countries in Latin America and revealed the high cost of lack of access to sexual and reproductive health. For women who became mothers in their teen years, they were 3 times less likely to continue education and obtain a degree, and earned 24% less than those who became mothers between 20 and 29. So while the rationale seems really clear, I think the traction must be better. In 2019, the Partnership for Maternal, Newborn and Child Health, with its more than 1,000 civil society partners, many of who are also part of this convening, launched a call to action on sexual and reproductive health and rights as an essential element to achieving universal health coverage. And it highlighted concrete steps that governments, the global community can take to ensure that highest attainable standard of health for women, girls, for adolescents, for vulnerable populations through UHC. And several attempts have been made to integrate SRH in universal health coverage. And even for those countries that have included it in their universal health benefit packages, many have included only some components of what we feel is a comprehensive package, including issues around gender equality and women's empowerment. And therefore, we must continue to make the case for the integration of SRH into UHC efforts and health plans at both national and subnational level, in particular where this movement and momentum in the recovery post-COVID sits. And so we really count on all partners, and especially our civil society colleagues, as key partners for global and local advocacy to support this effort. Back over to you, Rachel.
Thank you so much, Dr. Julita. And I just have to emphasize also that the reports around gender-based violence that happened during COVID-19, and as well as the disruptions to SRHR services have been such a huge issue to so many women and girls across the world. I'm just going to move now to Daniel Marguari. I'm going to move now to Indonesia, the host of the next G20 presidency. But I'm going to just focus a little bit more about HIV for now. So the UNAIDS report released in 2021 July states that overall key populations and their sexual partners accounted for 65% of HIV infections worldwide in 2020. And 93% of these infections are outside of sub-Saharan Africa. So key populations, gender and race disparities, and young children still continuously are at risk of being left behind. Despite commitments made over the years and years of commitments made by leaders in overcoming human rights violations and gender violence, barriers continue to exist and grow. So given your history of working with key populations in Indonesia, what do you feel G20 country leaders can do to truly leave no one behind? You'll have to unmute yourself, Daniel.
Yes, sorry. Thank you, Rachel. It's important meeting, and the topic is very interesting. Yes, leave no one behind requires a deliberate, proactive commitment. Now more than ever, especially with impacts of COVID pulling down on years of work. The G20 leaders have a bigger role to play in setting an example to the rest of the world what it really means to leave no one behind. and that is true, bringing the last mile first. They require working with each other to secure, to strengthen, significantly financing for health and widening the fiscal space for lower and lower middle income countries through meeting other commitments and making increased pledges to global health financing facilities such as a global fund. It is crucial that G20 leaders as donors to consider and to continue waiving loans of lower and lower middle income countries So the domestic resources for health and other social development aspects could be increased, facilitating sustainable development. G20 leaders can also lead by example in securing, protecting, and promoting equality and non-discrimination for all. Many communities are left behind actually because of existing laws and policies that either criminalize them or discriminate against them. That includes women and girls, adolescents, men who have sex with men, transgender people, people who use drugs, sex workers, people with HIV, TB and malaria, migrants, and also those who are living below the poverty line. As we are heading toward an ambiguous era, an uncertain post-COVID world actually right now, it is crucial that G20 leaders take committed action to address and resolve, also support other countries, to address and resolve human rights barriers and violations faced by communities and civil society living with, affected by, vulnerable to HIV and also TB, especially through facilitating a fiscal space for advocacy work and for community system strengthening and protecting the civic space. Right now, there are financial resources actually provided for advocacy and for CSS by entities like a Global Fund or civil, challenge facility for civil society and other donors, but they are not adequate to meet the demand and need to be increased significantly for advocacy work to resolve those barriers.
Great, thank you so much, Daniel. And I think it's important for us to also unpack. So when we keep saying build back better, but that's also assuming that before was good enough. So we need to make sure that we reconstruct, what we want, and make sure that that is the vision that we have in front of us and not the usual blah, blah, blah. So I'm going to move back to Dr. Ren. Dr. Ren, COVID-19 has shown why united action, solidarity is needed for a more improved and robust global health architecture. What are some of your thoughts on how G20 country leaders can move this from political talk, blah, 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 to political action and actually implement them? And what is the role of WHO in this process?
Okay, thank you, Rachel. This is very tough question. Let me try my best. A COVID-19 pandemic is absolutely powerful demonstration that when health is at risk, everything is at risk, which is why we need now more than ever a robust global health architecture that has the means to end the current pandemic and diseases we are working on, including COVID-19 and HIV, TB, malaria, viral hepatitis, or you can name whatever the community disease, non-community diseases as well. So it also has to be able to tackle future pandemics and to provide primary healthcare services to everyone. So an ideal model of robust global health architecture that can provide all of what I just mentioned to me is one that can provide some key elements. First one is strategic leadership, and then technical norm and standard setting, and then global advocacies to leverage pandemic threat to the highest leadership level if needed, and the coordination of all actors, stakeholders at international, regional, and country level through a well-graded mechanism, or we can call network framework. Of course, we also need to make sure this new global health architecture to be sustainable and predictable financed by all the member states. So consensus on this kind of concrete institution setup and operationalization of robust global health architecture may not be easy to reach sort of consensus, but this is why the leadership and the support of G20 is so crucial. In particular, the G20 can make a real difference in two aspects. First, ensuring the constructive dialogue around what is a global health architecture should look like, and then providing strong and long-term commitment to supporting the development of global health architecture through sustained political and financial support. And G20 has demonstrated that it can step up and lead the way by establishing the ACT accelerator for COVID-19 pandemic, and the same commitment and more probably is now needed to establish a robust global health architecture. Of course, we can only face the global health crisis when the global solution and with inclusion, ownership, and engagement, and the cooperation of all countries. This is exactly why WHO, harnessing the power of support its member states, can make a real difference. WHO can use its convening power to facilitate discussion with all member states and the other players and actors in the process. And also WHO has an important role to play in providing normative, policy, and technical guidance, and in supporting the countries in the region to build capacity for pandemic preparedness and response, and for resilience and equitable health systems. This is just a few reflections. Clearly, these big issues and very challenging questions. Thank you, Rachel.
Thank you so much, Dr. Ren. And you know that I will not just ask you easy questions. We do expect WHO to have some of the best solutions to actually implement them. So we're looking very much forward to the further discussions that WHO and other countries will be having in terms of what this global health architecture looks like. And in my opinion, I think it's more about global health solidarity, and it's not about global national security or global health security, as people are calling it. So we do want to see that, solidarity amongst countries. I'm coming back to Dr. Zolelwa. So despite the commitments by G20 leaders to expedite this COVID-19 responses in all corners of the world, we know that Africa still remains the most under-vaccinated region in the entire world at less than 3%, the last I checked. We do want to see equitable access to systems in place to improve health systems, and we want to be able to address infrastructural needs and shortfalls. So as a health worker, what do you see are occupational health and safety needs of healthcare workers and the health workforce, which has been exacerbated exponentially compared to developed nations? What are your thoughts and recommendations?
Just to check, can everybody hear me still? Great, fantastic. So my answer to this question is that the world and the G20 leaders and our leaders everywhere else in the world need to listen firsthand to the needs of the health force and act on them. I think applause isn't enough, calling us heroes isn't enough. I want to take this opportunity to share my own story that even before COVID, my health advocacy and the activism that I do started because I was exposed and I fell ill, and I was not protected by the health systems that I was working for. So I contracted multi-drug resistant tuberculosis as a medical student. And then I got into a car accident after a 36-hour shift at work. I was not supposed to make it out of that alive, but I did. And I've struggled with anxiety and depression for the last 10 years and suicidality as well. And then COVID-19 hit our shores in South Africa. And even though I warned, the systems where I was working that, look, we need to do something about this, I was left voiceless and I contracted COVID-19. So I was so traumatized by that experience and by the fact that I was not protected that I decided to leave the front line myself, because I was not feeling as though our leaders and our health systems are really doing the things that they need to do to protect us so that we do the job that has been put on us, So I was feeling this, and there's health workers all over the world that are feeling this. And the infrastructural shortages, they affect the lives of healers. So lack of oxygen in the hospital that you work at or no PPE works on you personally. You are anxious when you go to work. It's not just a thing that has to do with numbers and stockouts. You are there deciding who lives and dies, and it's about addressing the health and the well-being of our healers, the healers of the world, So I want to address the G20 leaders and say that they need to make a commitment today, now, to addressing the health and the health needs of our healers. Because if all the healers die, then what then, And that includes infrastructural needs, addressing those needs, because, yeah, it comes part and parcel of that. So please listen to us as a health worker, as a survivor of all these crazy things because of the occupation that I chose. Please, from developing and developed nations, the health workers need to be listened to. We cannot do this alone. You know, we cannot be expected to just accept the applause and continue when we are suffering because we're watching the communities that we work for suffering, you know. So it really is important to hear our stories and to act on them timeously. So please, to all the leaders who are listening, we need you now. Thank you.
Thank you so much, Dr. Zolelwa. That is so heartfelt. And I think that every life is a life. And I think that the pressures of our healthcare workers that they face during COVID-19 has really not been highlighted enough. When medical practitioners actually have to decide with one canister of oxygen, who do they give? It is
and then
not
you can't
fair.
sleep the whole night because you made this decision.
Made a choice.
And sometimes they won't.
Yes. And this is your choice to make. It is not fair for the healthcare providers to actually have to make that decision. So we do want to make sure that this call is heard loud and clear. And thank you for making it.
We need support.
I'm going to move.
We need support.
Yes, we need support and we need action. We don't want just blah, 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 right?
No, we need action.
I'm going to move to
now.
Lucas. Thank you so much, Dr. Zolelwa. I'm sorry, but we are running out of time and I'm really anxious about time. But so I'm coming to Dr. Luchika. We have heard from all our speakers, and I think it's important to know about the healthcare workers, but Daniel also pointed out the importance of the engagement of communities in civil society and health responses. We know that it's often difficult to engage TB and malaria communities in these decision-making spaces. So how can G20 countries engage their TB communities as well as the general communities and civil society in general? So in country processes, and what is needed to make this happen?
So, so thank you for this. And Luca, I think you will have more stronger points than me to say, so I'm looking forward to hear. But Rachel, thank you very much. And Zolelwa, as always, extremely impressive what you share with us. I think TB, I don't know very well about malaria, but TB community engagement is changing a lot. But as Daniel also said, we don't have enough the funds to really engage at the right scale. But, you know, we have this system in Stop TB, the challenge facility for civil society, from which we give small grants. You know, at a bigger scale, these are small money. But these are amazing money for creating, what I said, grassroots organizations that can stand up and become very active networks to push the agenda forward. And that's how we actually fund more and more, thanks to Global Fund and USAID, of this organization. So I would say that currently, just create the opportunity and give the space, because the civil society and communities will come. And next year, when G20 will be hosted by Indonesia, one of the highest TB burden countries, Danielle knows very well, we are looking not only at the civil society, but all the other partners in the country to really stand together, because we need this voice, and we see Zolela's voice representing the healthcare workers and providers, the affected community as well. And with civil society and, you know, we are in a different space in TB right now. I would say that we have global, regional, and country level networks that will be ready to be engaged. What I think is happening is what you say a lot, Rachel. I am afraid of the blah, blah, because we don't want a conversation in which, after all this work and preparation, civil society and communities will be there to tick a box. They should be the ones really not contributing, driving the effort. And I am really scared that this is not happening. And we spoke about this even in the context of COVID. And I'm a bit unhappy, because it was a good opportunity for the COVID money to construct all of this and really center in the civil society and community and build it up. And I'm not sure we are yet there. But for next year, and for the G20 engagements as well, for the UN high-level meeting 2023, we are all very prepared with the civil, and we will be even more. But resources are not enough, and what we have is a fraction, is a 20% of the total need, we estimate. So we will need more of that, but the energy and the passion will be there. And I think we should do a shoulder-to-shoulder activity of no blah, blah, but action. Thank you.
Thank you so much, Luchika, and definitely agree with you about the shoulder-to-shoulder action that is so much needed. I'm just going to remind us, our speakers, just to maybe shorten your intervention slightly. We are running slightly behind time, so I am going to move to Lucas. The Latin America and Caribbean region, compared to some parts of the world, has more progressive and democratic legislation, yet it often faces challenges in reaching the most key and vulnerable populations. So what do you think must be immediately implemented to achieve all the rights-related targets of the SDGs, particularly given the impact on health-related goals?
Yeah, first, I would like to say something before answering the question, because something is like really troubled me, but I understand that people might think that some countries in Latin America and the Caribbean have more progressive and democratic legislations, but it's ironic to me that in Chile, for example, we have laws from 20 years that are not being complied, as it is shown in the case, by the cases of violation of confidentiality in the process of vaccination. You can see that documentation in the page of the Circles of Students Living with HIV in Chile. And in Argentina, they have been under the same legal framework for 40 years, and now they are struggling to enact a reform that can change some things that can really help people live with HIV. Transmission is still criminalized in Mexico, and some months ago, a person was burned in the street. So I don't know, when people say like we are better, I mean, I try to think in all the cases, in all the countries, and it really worries me because we're not that fine. There are many things that we really need to solve right now. And other countries actually, such as Nicaragua, some activists are being persecuted and punished. So I don't know, one of the things that we should really be taken into account is to understand that Latin America and the Caribbean is a plural reality that constantly varies, and it's not a single reality. But now, for the question, some of the key measures we should implement include avoiding disproportionate, discriminatory, or excessive use of criminal law, ending discriminatory law enforcement against priority populations, explicitly prohibiting state-based violence, and holding law enforcement and security forces accountable for responses or disproportionate actions when applying COVID-19 response measures, taking proactive measures to ensure that people, particularly those from vulnerable groups, can access HIV prevention and treatment services and meet other basic needs. Ensuring that limitations to freedom of movement are specific, time-bound, and evidence-based, and that governments adjust measures in response to new evidence as such problems arise. Finally, as Luchika says so many times, governments should involve communities in all responses measures. This includes rapid and comprehensive consultation with several partners before imposing restrictions of movements and creating a space for voices to be heard in civil society to participate in and monitor the response to COVID-19.
Thank you so much, Lucas. So Dr. Julita, coming back to you, what are your recommendations for governments to ensure universal access to sexual reproductive health and rights services to eliminate all forms of gender-based violence?
Gosh, thanks again, Rachel. And in a way, it sort of speaks to your blah, blah, because I do think, in November 2019, the world came together, and I think they came together in a very special and different way, not in an intergovernmental process, but in a diverse process to look again at the commitments that had made 25 years ago on the program of action, which really centered universal access to sexual and reproductive health, but also gender equality, and how that was fundamental to a sustainable, just, and inclusive world. And in a way, we came up with, under what I would say actually was one of the strongest global solidarities around, what needs to be done and the actions that need to be taken. There were 12 actions that were put out in what we call the Nairobi Declaration and the footprint to achieve this unfinished agenda. And you know, in a way, it speaks to many of the things that have been said. But I do want to pick up first on one of the points Lucas has just made around how commitments in legislation actually don't always translate, and particularly for those most vulnerable. And I think if there's one thing that governments need to do is to not get distracted by counter movements, and particularly against issues of rights and gender transformation issues. You know, it is time for the world to really just say, we have to move on these. And those promises that we've made, we have to see them right through. And so really protecting the most vulnerable and those who they've really signed up to in terms of a rights agenda needs to be achieved. I think the other issues, and Lucisa said them really, really well at the top: money, people, etc., and political will. But two other things, and one is data. Because I think until we get better quality disaggregated data, and we use all the techniques of georeferencing, geospatial, but also trying to integrate those much better, whether it's civil registration data, census data, health management information data, gender data, all that needs to be really used as evidence to really find those who are going to be left behind and target and begin to work on that. So really an investment in that is going to be key. And I think an investment in applying innovative solutions. And in a way, I think COVID, has shown us that indeed we can pivot to things that we probably didn't think about, particularly in terms of delivery models, whether it's self-care, whether it's looking at online systems of telemedicine, etc. And we need to begin to realize their potential, but also to ensure that they don't counter and do what we don't want them to do in terms of delivering quality care. So I think in addition, obviously, to predictable financing that we call for, and really the commitments of donors to ODA, maybe the last thing is really just, governments really need to ensure that they stay focused on these and not be distracted by pushback. We see that continuously once it becomes too sensitive an issue, whether it's abortion care or it's services to LGBTQI communities or issues around Afro-descendants. Everybody gets panicky and nervous, and that must not happen. So bottom line, business differently with renewed urgency, with a holistic life course and a human rights-centered approach. I think that's the answer.
Thank you so much, Dr. Julita. I'm coming to you next after Peter sends. Daniel, if you don't mind. We know that Peter has taken some time from the very busy Global Fund schedule, the committee meetings happening this week. So thank you so much, Peter, for joining us for this session. I'm going to have two questions for you. The first one would be that it has been 20 years, marking the Global Fund's contribution to the deadliest epidemics we have faced. Before COVID-19, the Global Fund's fight against malaria has helped countries achieve malaria-free status. And today, we just congratulated WHO for the announcement about the malaria vaccine. And increasingly, we do see that that communities and civil society have been meaningfully involved through the Global Fund's support. What can the Global Fund do to increase more community engagement overall in its programs, and especially in malaria communities where the Global Fund invests? The second question is, we know the Global Fund will be holding its 7th replenishment next year. This takes place with even more urgency given the recently released but really sobering results report. Given the commitment of the Global Fund in strategy and realizing human rights and gender equality, which is fundamental in ensuring that we leave no one behind, please do share with us how the Global Fund envisions this will take place in continuing your fight against the 3 diseases amidst COVID-19, and what can all stakeholders and G20 governments do more and better of. Thank you. Peter, you're on mute.
Yes,
thank you.
Thanks, Rachel. And it's great to join all of you. First of all, I hope that yesterday's announcement, and the Global Fund was with Gavi and UNITAID and WHO, one of the funders of the pilots for the malaria vaccine, that this does herald a new phase in the fight against malaria. The fight against malaria has been actually a great public health success, but one which has kind of stalled in the last few years, particularly with COVID disrupting services. So now is a great opportunity with new tools. And it's not just the vaccine. We have other new tools, new next generation of bed nets and so on, for us to go into the next phase of reducing both infections and deaths, because it's still the case that the best part of 500,000, 500,000 people die every year of malaria, mainly children under the age of 5. Communities play a massive role. Given the nature of the disease, many of the people most affected by malaria are not actually within reach of formal healthcare systems. So community health workers are often the lifeline to diagnostics and case management, and that's what keeps people alive. They also play a critical role in ensuring that vector control, so mosquito control measures, are deployed and used effectively, such as bed nets, such as keeping the environment around houses as clean and uncluttered as possible, removing stagnant water. Communities are the people who know where that's happening and can deal with it. And so communities do play an absolutely central role. For our part, we see the need to reinforce that. So we want to see even more community engagement in regional, national decision-making around what is happening, what the priorities are for malaria programs. We see a need to scale up and support community health workers. And too often they are underpaid or not paid, undertrained, and underprotected, particularly in the context of COVID, lacking PPE. Community-led monitoring has an important role to play in ensuring that the commodities, the medical life-saving tools that we work so hard to try and deploy, actually get to the people who need them most. And critically, malaria, like the other infectious disease, is a disease that thrives on inequities and thrives on human rights and gender-related barriers. And that's why the Malaria Matchbox program with RBM, I think, is a critical aspect. And so we've been involved in all those aspects, and we are providing support to the civil society group for malaria elimination. And I think we will need to dial that up on malaria, but we will need to do it across the diseases. And if you've seen the latest iterations of the Global Fund strategy, it's very clear that communities are at the center of the next phase of the Global Fund strategy. And that links a lot to your question around the COVID, of the Global Fund's replenishment next year, our 7th replenishment. It's hard to believe that having only just done the 6th replenishment, it feels like in 2019, we're suddenly immediately going into the 7th replenishment. This is going to be, people who've been in the Global Fund a long time say, we always say every replenishment is the hardest one. This, I think, is definitely going to be the most complicated one, because there are so many cross currents in the world and so many different demands for money in the global health arena. We will not have finished with COVID-19. There will still be a need for COVID-19 money. There's the whole pandemic preparedness agenda. And we will absolutely be looking for support to regain some of the losses that we've seen on HIV, TB, and malaria during the course of COVID. And I think one theme that unites all three of those things is the importance of focusing on the poorest, the most vulnerable, those who are marginalized. We know that in HIV, TB, and malaria. We know that there's a kind of vicious cycle of human rights and gender-related barriers and the way epidemiology works that exacerbates the impact on the most vulnerable. COVID-19 is exposing exactly the same dynamics, but most countries' COVID-19 responses aren't informed. And Lucas was they aren't infused with that same kind of mindset of engaging communities, of dealing with the barriers that result. And I worry that the pandemic preparedness agenda, when you read most of the stuff on it, it's not rights-based. It's not sensitive to inequities in the same way. So I think we do need to really drive that agenda. Not just, I mean, of course, I'm primarily focused on the Global Fund replenishment, but the whole global health agenda in 2022 needs to have that focus on inequity, on human rights and gender-related barriers, and on not kind of moving on to the next thing when a disease has stopped killing people in rich countries. We sort of lose interest and only worry about the next one. Over.
Thank you so much, Peter. And you have highlighted about the need for the reduction of inequalities, and we need to be able to address the heart of the issues, which is about human rights, gender equality, and making sure that people remain at the center. And we need to be able to keep to the commitments and hold their feet to the fire. Thank you so much for making time. I'm going to come to Daniel for one last intervention, and then before we end, I'll pass it over to Kurt for closing remarks. But I want all the remaining speakers to have a think, to use one word you want leaders to take note of. Just one word. Okay, Daniel, please tell us one key thing that you think should be prioritized, given that Indonesia is hosting the G20 presidency in 2022. So what are your hopes for Indonesia's leadership in this, and one key issue that you feel needs to be prioritized?
Yeah, because as a country that will host the G20, I think Indonesia can set the agenda of G20 discussion. That's become one of important to reflect on true and realistic commitment to the achieve to the SDGs, and make sure the world leaders think differently this time about the global health solidarity and universal health coverage for all. As a country that is implementing intervention for STB malaria, which support the global health facilitating financing facilities such as the Global Fund and also other donors country actually. So Indonesia in the unique position to speak for both sides of the story. Hence, it needs to play a very convincing role within the G20 next year, or also the year of the Global Fund 7 replenishment, to push for more increase and early pledges from G20 leaders to the Global Fund. I'm thinking we as a communities and civil society in Indonesia will support and continue to advocate the Indonesian government to play a very important role in setting up the G20 agenda and discussion. And we'll work with communities and civil societies in the world, like such as the platform of C20, GFAN AP, AP, APCASO, and others, to continue the advocacy work.
Thank you so much, Daniel. And we hope that we will physically see each other in Bali next year if the world, everybody has vaccines before then. And we hope that we are able to do that. I'm going to move very quickly, one word each to conclude your hopes and expectations, and I will start with Stefania. Unmute yourself, Stefania, one word.
Yes,
one word.
Equality.
Equality, thank you. Dr. Ren. Unmute yourself.
Investment.
Investment, thank you. Lucas.
Commitment.
Commitment, thank you. Dr. Julita.
Oh, the good words have gone, but I'll do yours. Solidarity.
Thank you. Dr. Luchika.
Empathy, love.
Thank you. Dr. Zulelo.
Support.
Yes, thank you. Daniel.
No
one
blah,
word.
blah, blah.
No blah, blah, blah. Okay, I'll accept
blah,
that.
blah,
Thank
blah.
you. Peter, one last word from you.
Humanity.
Humanity, thank you. Thank you so much for everybody for your great messages, and we hope that that will stick in the hearts of all the G20 leaders for this summit. I'm going to hand this over now to Kurt for closing remarks.
Yeah, thank you very much, Rachel. Well, as part of the C20 Global Health Facilitator team, I want to thank all the participants for the important concepts and ideas that were shared today. I took some notes and have some thoughts that I would like to share with you. First of all, the pandemic has proven that health is nowadays more than ever a political issue, and that leadership and a strong global governance are required. A new social pact to decide future priorities is required, since we have seen global challenges not seen before during our lifetimes. The pandemic is far from over, and its consequences in the long term in other health issues that were unattended, as chronic diseases, mental health, sexual reproductive health services, HIV, TB, and malaria, as well as other infectious diseases, is still unknown. But not all are bad news. We heard today that an effective vaccine against malaria has been developed and will soon be available. A lot has been talked about vaccines, and the truth is that the research and healthcare sector responded even faster and better than expected. But still over 80% of all produced vaccines are being used even as a booster in the developed world, while most African and other low and middle income countries are still waiting. Vaccine nationalism is still stronger than vaccine equity, even with the risk of new virus variants appearing. Vaccines become useless if not widely distributed and applied everywhere and to everyone. People's lives must come before profit, but international solidarity seems to be out of the question. Civil society has an important role in reaching the most vulnerable, both in service delivery and also raising awareness among communities. How close are we to the universal health care agenda? Universal health care is not only a health issue, since it drives improvement in most other SDGs also. We need sustained investment for health system strengthening and infrastructure, since it is a fact that globally seen, our health systems are as strong as its weakest link. Health is not only a public good, but an investment and not a cost. And COVID-19 is proving that the cost of inaction is of great magnitude. Without resources, no health system, no development towards universal health care will be possible. Civil society has not been involved in almost any COVID response strategy. The pandemic just highlighted the lack of civil society engagement. We want our participation globally and locally in all the health policies to guarantee accountability and overcome COVID-19 through a people-centered, human rights-based and gender transformative approach, leaving no one behind and putting the last mile first. The only new
Thank you so much, Kurt.
The last sentence only. The only new and unexpected development in the pandemic is the new coronavirus, but government's response continues being the same, although business is clearly not as usual. Thank you.
Thank you so much. So no business as usual. I thank all the speakers for their time. Sorry, we've overrun a little bit into the next session. A great round of applause for all of you. Thank you. Keep well, stay safe, and we will have to continue this conversation and keep the fight. Thank you all. Good night. And for those that are on, please continue to stay on. We are issuing the final communique from the C20 in this session. So for those that are interested, you're in the right channel. Please stay on for those who would like to stay on. Thank you so much again for speakers. Over to the next moderator. Thank you.
Thank you. Bye.
Yes, thank you. Can you hear me now?
Yes.
Thank you very much. And now this is the very, very last session of our C20 Summit. Now this is the very, very last sorry, I have I can hear my voice again. Okay. Maybe not now. Okay. Can you hear me?
Yes.
Okay. Sorry. Okay. So welcome again to the very final session of our civil society, C20 Summit. We, dear colleagues, we have reached really the end of this summit. So thank you very much to the organizers of the various events and of course to participants. I am pleased to say that hundreds of people joined the summit from many countries. The C20 summit events, I think that allowed us to have a deep dialogue on the topics on the international debate we have worked on this year. We would have liked to have had an opening session with the Italian Prime Minister Draghi. We hope anyway to have at least one video message from him before the end of the G20. And as for the Italian G20 Sherpa, Mattiolo, unfortunately, he is involved in an institutional meeting today, so could not join us for this final session, but we hope to have a final virtual session with him in the next days. We will let you know, of course. I would like to thank the members of the Civil 20 for their enthusiasm and commitment, the coordinators of the working groups and the other members of the steering committee and the International Advisory Committee and the Troika colleagues for their valuable support to the C20 presidency for this important summit. As last year, we are still in a challenging phase characterized by COVID, and as last year, we had to organize a virtual C20 summit. We all know that virtual events entail a certain amount of fatigue. The positive side is that we could involve the wider C20 audience. We will see if virtual events will be one of the legacies to our Indonesian colleagues who in December are taking the C20 presidency. I have to say that a legacy we didn't want to leave is the fight against the inequalities in COVID-19 vaccines and tools access, but we will not give up. And this applies to the other principles and rights on which we as a C20 have always been at the forefront. Before giving the floor to our Indonesian, Indian and Saudi colleagues, I would like to thank the Sherpa team, Riccardo, Valeria and Stefano, who faced the countless series of commitments that would have required at least double the available human resources. And also thanks to Lorenza for her work within the Secretariat and Isabella for the communication activities. So stay tuned as we still have some events to work on. The G20 Traders meeting in a few days, the G20 Joint Finance and Health Ministers meeting, and the G20 Leaders Summit at the end of October. Thank you very much. Riccardo, Valeria, please.
Yes. I think the colleagues from the steering committee at the International Advisory Committee could switch on their camera, so we all, also the people that are linked and following the meeting via streaming can see us. And I see, or at least I saw before Maftu. I don't know if Maftu Chan is connected. Maybe he had Maftu, are you there? Oh, yes. Okay. So please, over to you, Maftu. Maftu Chan is one of our colleagues from Indonesia. And in the tradition of the C20, the final communique of the Civil 20 at the end of the C20 Summit is presented by the following presidency. So, Maftu Chan, over to you.
Thank you, Ricardo. Dear colleagues and friends, good morning, good afternoon, good night to all global CSO leaders. I'm Aha Maftu Khan. I'm co-chair of C20 Indonesia. In this remarkable moment, allow me to, on behalf of Civil 20 Troika from Indonesia, to express our highest appreciation to all the hard works Civil 20 Summit Italy have done. The completion of Civil 20 Summit 2021 is our milestone that we need to celebrate by strengthening our commitment in the further action as part of our global campaigns and our global citizen. So the C20 2021 Summit has highlighted of addressing a global dream to achieve three priorities agenda. As we know, people, planet, and prosperity, which are guided by G20 Italy presidency this year. The summit reminds us that ambition can only be channeled through framework, planet, and democracy. As we all believe, no prosperity, in fact, impossible without the inclusion and the active participation of all. So, colleagues and friends, for the people, we need strengthen our action to address a global COVID-19 pandemic. So, we already seen that this situation is very unfortunate when rich countries have ability to purchase vaccine, but some countries like Asia and some countries in Africa not even purchase dose of its citizen. So we need to strengthen agenda to equal distribution of vaccine. The only way to increase in the vaccination production is how we support trip waivers. So G20 leader must be proactive in fostering multilateral initiative and to ensure that all citizens have access on universal health coverage. Colleagues and friends, for the planet, we need action to decarbonize the global economy and start healing instead of destroying nature. G20 leaders obliged to provide a strong mandate for climate for their national and regional public financial institution. We call a strong commitment to protect health of people as well as the health of planet consistently. We welcome the frequent mention of One Health approach in the G20 document. So we also call for ending fossil fuel subsidies and introducing carbon pricing to promote a fair, just, and rapid decarbonization of economies, making real the promise to phase out coal by 2030. Colleagues and friends, in democracy, yes, we all agree that protecting people's and the planet's life can only be achieved if the fundamental rights of freedom are guaranteed by all development actors. And then tackle corruption related the organized crime is fundamental also to enable stronger participation of civil society. As we know, a lot of activists got difficulties when they try to make a campaign and advocacy on corruption cases. Colleagues and friends, last but not the least, as the C20 Indonesia, I humbly congratulate once again to C20 Italy for a successful C20 Summit 2021. We are very much looking forward to welcoming all of you at C20 2022 Summit in Indonesia that will bring a number of priority agendas as well. In the next presidency, with a strong commitment and the fiery spirit of multilateralism, C20 Indonesia is ready to take the lead to continue the policy recommendation and to call for stronger collaboration, for stronger cooperation between us, between civil 20, between countries, between other engagement group, between developed and emerging one, from the north to the north, from the south to the south. And we really welcome to all of you in terms of how we are strengthen our commitment, our action. The ultimate goal of our presidency reflect in the themes of next year is recover together, recover stronger. So the collaboration, multi-actors, multi-dimension, multi-sector is needed. Yes, to achieve this goal, we will continue to pursue our consensus on trip waiver to achieve fair and just access to vaccine. As for climate risk mitigation, we also fostering green economy and sustainable finance in post-COVID-19 recovery, halting the use of coal for its adverse impact toward environmental and economic development, enforcing carbon tax regulation, and also adding gender balance principles by accelerating gender and social inclusion. In regard to economic issue, we will bringing economic justice for the poor and for the poorest in the next agenda. We are committed to bring tax justice on the pursuing more state income for financing development, for financing program for the poorest. Especially from the digital economy. And by the way, we will work on creating global policies that establish interstate cooperation, inter-actor cooperation, and enact transparency to eradicate transnational corruption, illicit financial flows, and money laundering in the global fora. Finally, allow me to end this by warmly congratulate again to C20 Italia for delivering such a fruitful G20 presidency 2021. Our work is not done yet. Let's collaborate to recover together, recover stronger. See you in the G20 Indonesia 2022 next year.
Thank you, Maftu, and thank you really also for your words. For everybody, the final communique is available in our website, the same website that you used to be connected today, so you can download it, and please help us in sharing it, in making it known among our constituency and our partners and political actors, to show that I say cohesion and that solidarity that is the main feature of Civil 20, working together from one year to another, from one presidency to another. I would like to ask Osama to have some words at the end of this strong year. Please, Osama, over to you. Osama is representing the Saudi presidency of last year, for who don't know him. Please.
Thank you so much, Ricardo, and thank you for this opportunity. It's amazing to be back together again. And I would like to start by congratulating Stefania, Ricardo, and all the C20 Italy team for a very successful summit. You've managed to fill this space with all the difficulties around holding an online meeting. As Ricardo mentioned, I would like to talk a little bit about the process of the C20, looking back to the years when we first joined the C20 during the German civil society presidency. We learned a lot. We got to know many of you over the years, and we learned the process that has strengthened over the years. And this process was made sure to be continued through the principles of the C20 and through the Troika structure, which, as you know, always brings in the future presidency with the current presidency or the old presidency to ensure the consistency of the asks and the expertise of civil society. As you know, the C20 is the official civil society engagement mechanism for NGOs around the world to the G20 governments. We are unique in the way we provide our perspective, because we provide a non-government, independent, non-business point of view that speaks on behalf of citizens, that speaks on behalf of the vulnerable and people worldwide. And to do that, we have to maintain a certain set of processes and principles. And I thank all the previous presidencies and the Italian presidency for continuing to respect the C20 principles. And I am sure that we will be in great hands with our Indonesian colleagues, making sure that these principles come to life and continue to serve as guidance for the governance of the way forward. And most importantly, the global character of the C20 process, because when you speak to the government of the G20 presidency, you don't speak on behalf of your local NGOs, you speak on our behalf. You speak on behalf of civil society from the G20 countries and beyond. And for that, you need a strong presence of shared understanding, for shared solutions and shared recommendations, for shared challenges. And this is possible through making sure that every working group, every committee, the steering committee, the advisory committee are all well represented with old-standing experts from civil society, but as well as experts from your own community. And this is also a learning opportunity for the local civil society to join and learn and broaden their understanding. Our Saudi civil society learned a lot from the engagement with the C20. I also would like to stress the principles of transparency, independence, collaboration, inclusivity, and predictability. I know predictability is quite challenging in times where COVID-19 is controlling our lives, but to the greatest extent possible, we try to share our dates, share our plans, share our outcome documents ahead of time, try to make sure that everyone knows where we're heading and that we have the buy-in of everyone. Because at the end of the day, the government of the presidency is only one member of the G20, and we need our collective efforts to lobby all G20 countries, because at the end of the day, when it gets to the summit, when it gets to the ministerial meetings, it's all the countries that are voting and making sure that the decisions are not unanimously made or unilaterally made by the presidency. I congratulate you again, and as our previous presidencies made themselves available to us in help, we made ourselves available to the Italian colleagues, and we continue to be at your disposal for our Indian colleagues, for our Indonesian colleagues. Should you need any help, should you need any advice, we will always be here for you. We wish you all the best, and we congratulate the Italians again for a successful summit. Thank you so much.
Thank you, Osama. And I would like to ask Arsh to share with us a couple of words. Arsh is representing India civil society. This year, the Troika was formed by 4 countries. Normally it's 3 countries, but having India that was already preparing to be the next presidency after Italy, and then with this change at the end of last year, not expected, put in place by the G20, we decided to be together, to work together anyway. So we heard the voice of the Indonesian colleagues, the voice of the Saudi friends, and please, Arsh, share with us some of your remarks.
Thank you, Ricardo. See, the interesting is that everyone who is part of C20 has to be the, it's not a Troika, but everyone is Troika in this, because organizing C20 is a very challenging proposal in it itself. Because see, in all other interest groups under G20, they have a solid backing, either financial or technical, or they have acceptance from the global G20 itself. But as far as C20 is concerned, C20 doesn't have that resources. C20 has to work doubly hard to get its space and its voice heard. And I've been involved with this whole process for quite some time, and we have seen that how we have got space, how we have got the recognition, and how we have got energy as a C20. So I will say that everyone, every organization, every CSO is a part of Troika, whether their country is part of G20 or not, whether their country is hosting or not. But we have to be very active, because there is, if you see, the structure of G20 is such that with the presidency, the priority shifts. But every time there is absence of consistency, if you see, and there is no permanent secretariat available like UN or any other like ADB or all. So C20 has to look for the continuity of the knowledge which has been created by each presidency of C20. So C20, I think if it is, whether it's a German C20, whether it's a Australian C20 or Japanese C20, Argentina C20, we have to take knowledge, move it like a relay race, like a relay baton, and you run with it. So I think that is very important. That was my first point. My second point is a special thanks to the Italian colleagues, because organizing the C20 in a very challenging times. It was a very challenging times because it was the normal. We started the process and we met only once for Saudi presidency. And then afterward, this whole onslaught of COVID came and we all went on online mode. We were not that comfortable for online technology and methods. Everyone was not like that. Our grassroots organizations were not like that. But this COVID actually did expose the fault lines, and it is also a great leveler of civil society worldwide. We learned new technology. It was a challenge for all of us. I think it started with the Saudi presidency, and it was a very challenge those days, that how we are going to keep the participation intact, how we are going to keep involvement intact, and how we are going to keep the continuity of issues like SDGs in part of the whole processes. I think we continued with Italian presidency also, and Italian presidency, Riccardo, Stefania, they faced this huge challenge because we have not met a single conversation on face-to-face. Everything is online. But thank you. You took this whole baton in a very energetic way. You all look tired, I know, but all the hard work is paying. Another point is also important is that, this whole COVID has taught us one more thing. We used to discuss this thing in our G20 conversation, that G20 or the response of civil society is very much event-oriented. Like there's a presidency, then there are events within G20. You have financial meetings or meeting of health ministers, and our response was very much specific to those meetings. But I think we have learned one thing, that yes, we need to have a consistency, we need to have a our own standing, our own processes, and our own objective, which is long-term objective, which we have to achieve from this C20. Other platforms, I don't know what is going to be the future of BRICS, but the new compositions are coming up. But gradually, this COVID has also shown that UN system is not that effective at the time of crisis. You know how our countries were dealing with WHO. You know, they were arm twisting WHO and all those things. But I think that it is a role of C20 also, that how they can influence the G20, which are supposed to be the powerful economic forces, that they should have their commitment intact towards UN system, because UN is the only system where we have limited space to raise voices. I think that we have kept in center of our conversation in this Italian presidency also, and I'm hopeful that in Indonesian presidency we will keep that also in a center of it. And I have great faith also, because interestingly, all these countries, they have a very strong civil society, very vibrant civil society in their country, and we know that there is a solid backing. So whether it's Indonesia, we know we have INFID there, we have other national platforms and other movements in Indonesia very active. Italy is known for its active civil society. India definitely struggling with its civil society for quite some time. You know all about it. So I think it's an energy. We have to keep that energy intact. We have to see that how we can keep that spirit alive till vaccination. And vaccination is a politics of its own. You know, like they call it nowadays nationalism, vaccine nationalism, in which vaccines are stored by one country and there is no vaccination in some countries. I think that we have to keep in our mind that has to be taken up. SDGs have lost their focus. I think many countries have gone back to almost 10 years in their economic growth. I think those things we have to take. And I'm very happy that we are trying to maneuver, trying to steer this whole civil society movement in this challenging time. And let's keep, because we also have another challenge, Ricardo, you must have seen that the challenge is also that of language. We are, most of us, since India was colonized by British, we speak English. We don't know what is Spanish. We don't know what's happening in Italy. I think the role of civil society movement is also to how to make us understand with each other the achievements of the civil society. In this whole COVID, globally, civil society has done excellent work without much resources, because they have been fighting for their shrinking space. They have been fighting for the regulatory frameworks in each country. Their funding went out of their basket. Their donors changed their priorities. In some places, they had very few funding. But civil society operated in this challenging environment in a very excellent way. We need to remember that, we need to document that, and we need to put in the agenda of G20 that no one can manage alone, whether it's a country, whether it's a government or a private sector or NGO, crisis like this. So we have to work together. We have to work in collaboration. Thank you, Ricardo. Thank you.
Thank you. Thank you, Arsh. Yes, this issue of the language is quite challenging. We've been able to provide for this C20 summit, at least for one room, translation in 3 languages. And we did it with the support of our government that provided us with this system, and we have to thank the government, in fact. But yes, this is a challenge. Otherwise, all our reflection could be a sort of a reflection of an elite that can access to a language, but a lot of area in the world can't have this opportunity, and it is something that is challenging us. I think that we run practically out of time. It's very late. I don't know if anybody would, Stefano and Valeria, do you want to say at least an arrivederci from your side?
Riccardo, excuse me, I just wrote in the chat that I would like to thank the interpreters for their excellent work.
Of course. With the interpreters, we have to thank also all the technical support we received in the organization of this we use a service. They are listening to us in this moment, and I like to say thank you openly to them because they've been very helpful. But again, Stefano or Valeria, do you want to just yeah? I think it's very late. From my side as well, thank you to all. Let me mention our friend from Fiji, Akmal. It's 2:39 in the morning in Fiji, and Akmal is following stubbornly our work. This is what civil society usually does. There is a sharing effort together. This is reason why we put in the first line of our policy pack and of our final communiqué that reflection on vulnerability. The model of someone else, maybe even of the G20, is to build a world among the strong, and thanks to that strength, being able to welcome and to help the vulnerable. So what we think is needed is to build a world based on our vulnerabilities. We are all vulnerable. And if we use our vulnerabilities as unit of measurement, if we use our vulnerability, sharing those vulnerability and sharing our skills and our talent, we will be able to build a world that can be home for everybody. If I'm being helped, I am a visitor that I have to thank the owner of the house, but I'm not at home. And we want a world that is home for everybody. And that's the reason why we ask always the G20 to support and to strengthen UN processes, multilateral processes, because UN, with all its limits, like Arsh was reminded before, is anyway home for everybody. And we will continue in our effort trying to work engaging, involving at the grassroots level all citizens, all women and men, all human beings, to build it together. What we do simply is building together. And we are tired, as someone said, we are very tired in this moment, but I think that we won't stop in building and working together. So from myself, let me thank you, everybody, personally, and even without mentioning anybody, but Valeria, let me thank particularly Valeria, because I need to do that. Otherwise, I wouldn't be able to do what I personally did, but I'm just one in the mosaic of the Civil 20. But anyway, my contribution has been possible thanks to Valeria, and let me say also thanks to my family, and thank to all the family of us, because being awake like Akmal at 2:30 in the morning means that someone is letting him doing that, or waking up very, very early, as Kurt or Patricia or Aldo did this year for having meeting at 6 o'clock in the morning. Thank you again, and we will have some other step before the G20 Summit. A statement on environment, possibly something on Afghanistan, and the end of a meeting. But we are closing in this moment the most important meeting of our year. And thanks to this common effort, the C20 Summit is over.